Twins World, all about parenting. Hope you all are safe and sound in your own places. Today we are going to discuss about another important day, that is Epilepsy Awareness or Purple Day. This day is celebrated to bring awareness in the public regarding epilepsy. We call it as fits, and how to take away the myths and the stigma what the public is having about this fits in a common man's term, and how we can help the person who's affected with fits. The good news of this particular condition is the early we are able to diagnose or find out the condition, it's easily manageable by giving adequate treatment. Coming to discuss about the term fits. Usually in our normal brains, the nerves in the brain communicate each other by having some electrical impulses. In case of this epilepsy or seizures or fits, we use these different terms. So what is happening is one part or more than one part of the brain bursts with abnormal impulses. This may end up with some kind of movements in the child. I'm talking mainly with the child. So what is happening is the fits can be seen for a various variety of moments. Sometimes we can see the loss of consciousness, that the child become unconscious, or the sudden jerky movements of the extremities. The full body can be stiff. The child may come up with involuntary activities or irrelevant talk or staring or any other kind of manifestations. So these are some of the things you can expect in a child. So once the child started having fits, so what happened once it is finishing, immediately the child will go to a completely tired phase. We call it as post-icterial phase, whereas it takes hours and weeks for the child to recover from the kind of abnormal movements what the child is having because of the abnormal electrical impulse what has happened in the brain. Okay, now we are going to see how we can help the parents as well as the children, those who are having fits. First thing is, as a mother or a father, I should take away the myths and the stigma what people starts putting in me, because it's a very common thinking that the child those who are having fits will be mentally abnormal. So what you can do is, if our child is having, or anyone, if we see someone who is suffering with this kind of illness, that is fits, we can tell them to consult a pediatric neurologist, whereas they can take out all their concerns and fears and get correct answers to come up with how to manage the child. The first you and I are positively enforced by taking away all the doubts, fears and all. Then we can impart this positivity in the child. Obviously the child is also going to be affected by this particular illness. There can be an inferiority complex, there will be a fear of failure, rejection. They are not able to mingle well with the friends because friends always keep them aloof. So you can see variety of emotions in the children which can lead to failure in academics as well. So what I can do as a mother is, I need to be first positive in my thinking and praise the child for even the small attempts he is taking, because once the child is getting this fits, the child will be very tired. So recovery takes time. So what I can do as a mother is give a pace for the child so that the child will come up by himself or herself. So once the child has come back to the routine, tell the teachers in the school or the friends, relatives or the people around them that how they can be conscious, how they can manage if something happened to the child. If you started some anticonvulsant medication, that is against this fits, we are giving some medication, please be regular to give this particular medications. Suppose if the child has fall down with a fits episode or a convulsing episode, If you have been to doctor once, they will be giving a sedative spray. This spray is meant to stop the abnormal impulses and sedate the child so that there will not be any further harm to the child. So this way you are able to manage. And once the child started with frothing and passing urine and motion, then you need to understand that the child is in convulsion. Give a sideline position with legs and hands up. We call this a recovery position. This position is given so that there will not be any aspiration of the froth or the saliva or the vomitus the child is having, which is very common in this particular convulsive episode. We had a practice before that. Keep a spoon in the mouth so that they will not bite the tongue unknowingly, or give the keys or the knife in the hand, that is any metal you give the hand to the child so that they will stop convulsing. But that is not at all beneficial, so stop practicing all those things. If the child is non-stopping with the fits and continuously having jerky movements, rush to hospital, because immediately they will sedate the child and do further management so that the brain activities can be recovered. Avoid increase in temperature in children, that is manage fever. If you are giving paracetamol or medicines for reducing the fever, if the fever is not reducing, give tepid sponge, that is wipe the child with water so that the temperature can be reduced, because increasing temperature of fever can be a trigger factor for children to have fits. Again, decrease in the sugar level or increase in the sugar level also can lead to this kind of convulsions. Hope this session has given in nutshell how to be aware for a common man with fits, and what as a mother or father, how I can take care of the child. Hope to see you on the next session with another interesting topic. Till that, stay safe and stay happy. Thank you.